So, what are you up to? These are the... I'm a spine surgeon at Vancouver General Hospital, so I deal with adults who have spine problems of all sorts. I first met Joe and Rosalie Segal in 2003 when I admitted Rosalie for surgery to relieve compression of the nerves in her back and perform a fusion. In 2007, we had the opportunity to help Joe by again doing a similar procedure where we relieved the pressure on some nerves in his low back. In 2009 and 2010, Joe and Rosalie again found themselves coming to Vancouver General Hospital, and this time for more serious medical problems.
Oh, I was very ill for approximately 2 years. I had extreme nausea, extreme fatigue. I just had everything going for me, and I had nothing. I had no health, I had no life. One evening, the symptoms became a little bit different. There was more pressure on my chest, and I had a very scary night, almost afraid to fall asleep. In the morning, the pressure was worse.
Rosalie presented with very atypical symptoms. We know that women often present differently to men, but Rosalie's symptoms were very unusual. And it took a long time for us to make a diagnosis.
Dr. Isserow said the only thing we can do is an angiogram. It's invasive, but I think that we have to do it. And I agreed. I said, I've got to get to the bottom of this. And then they found that I had 2 major arteries, 70 to 80% blocked. And by the time I went into surgery, I had a quadruple bypass.
Rosalie underwent surgery called coronary artery bypass graft surgery. This really was, in Rosalie's case, a life-saving operation. And she should do very well. As long as she looks left, right, and left again when she crosses a road, she shouldn't have any problems for the foreseeable future.
Before, I couldn't plan hour to hour, but now my life was back to normal. Dr. Isserow gave me my life back.
As you go through life, you learn to cope with many things. This is the only thing that I have experienced in my life that I couldn't cope with. And because of the end result and the persistence that Dr. Isserow had in finding the answer to your problem, not only did he give her life back, but he gave me my life back. Imagine waking up in the morning, turning over and trying to get out of bed, and you can't move. And you wonder, what is it? That's how my stroke started.
It was very frightening, very, very frightening. We did not know what was happening.
When I arrived at emergency, it was very early in the morning, and I went through all of the tests, and the problem appeared.
The cause of Joe's stroke was due to a blockage of a small artery in the back of the brain, in an artery called the basilar artery, which is a very critical artery supplying the brainstem. The potential worst-case scenario for Joe's stroke is that the stroke could have continued to progress and evolve, leading to either a complete paralysis of the right side, or, as sometimes happens with the blockage in the basilar artery, you can actually have a stroke affecting both sides, both right and left side, essentially leaving you quadriplegic.
Because they treated me in the expeditious manner that they did, the ongoing problems with the stroke were considerably minimized. And if that had not been the treatment at the time at the hospital, I would probably be somewhat impaired.
Well, Joe was in our hospital, in our stroke unit for 12 days. And of
course, the nurses up on the ward would have loved to have had him a lot longer. He soon became the sweetheart of the ward. But initially he was actually unable to get out of bed. He was profoundly weak on the right side, and then we gradually had to mobilize him with the help of our excellent nursing staff, our physiotherapists, our speech therapists, our occupational therapists. The whole team swings into action to gradually mobilize him, get him up on his feet, get him walking with a walker, and get him safe so that he could get home where his rehab could continue at home.
From Dr. Teal and his team and every other individual involved in the neurology floor at VGH were heroes.
Joe worked very, very hard to regain his strength and to be everything that he was. He's not a person that you can keep down.
Now I think I'm if not 110% normal, at least I'm 100%.
Our dedicated healthcare teams are passionate about bringing the best possible care to patients who come to us from all over British Columbia. Through support of the Foundation, British Columbians can be assured that they're going to have the highest quality research, facilities, equipment, and the highest quality clinical care available at Vancouver General Hospital.
It's exceedingly important to help patients with heart disease who really need it the most. Donor money becomes the great equalizer. So VGH becomes, with donors' help, the go-to place for people to come to for specialized and super specialized care.
Over the years at Vancouver General Hospital, donor support has helped move our stroke program forward in many ways. Moving forward, we need to recruit more people. We need to recruit academic stroke neurologists who will further our academic mission and, of course, help us at the emergency department as well when they're on call.
How can you not appreciate the kind of care that the VGH provides for their patients? You know, it takes a team. The esprit de corps on the part of most of the people that I encountered during my 12 days of stay were beyond the call of duty. They had a dedication that was unquestionable. I believe what we put in is what we get out. And if you put nothing in, you get nothing out. And so we have to make sure that even though the government cannot provide everything, it's up to us to provide for the next person.